Hello everyone, my name is Laurice Minton. I'll be doing my persuasive speech on taking cigarettes off the shelf. So as I stated in my informative speech, I spoke about marijuana and how it's illegal, and even though I feel some people do abuse the marijuana, but it does help some of those who have terminally ill diseases. So I feel that is more of a purpose to be legal than cigarettes. Cigarettes doesn't really serve a purpose. It's not for any kind of medicine or anything like that. So I think it should be taken off the shelf because it causes so many health problems, so much damage to your body that it's just not good for you. So here are some of the facts on why I think that it should be taken off the shelf. It harms nearly every organ of the body, causes many diseases, and reduces the health of smokers in general. Quitting smoking lowers your risk for smoking related diseases and can add years to your life. Smoking is the leading preventable cause of death in the United States. Cigarette smoking causes more than 480,000 deaths each year in the United States. This is about 1 in 5 deaths. Smoking causes more deaths each year than all of those combined with HIV, illegal drug use, alcohol use, motor vehicles injuries, firearms related incidents. More than 10 times as many U.S. citizens have died prematurely from cigarette smoking than have died in all the wars fought in the United States during its history. Smoking causes about 90% or 9 out of 10 of all lung cancer deaths in men and women. About 80%, 8 out of 10 of all deaths from chronic obstructive pulmonary disease are caused by smoking. Cigarette smoking increases risk for death from all causes in men and women. The risk of dying from cigarette smoke has increased over the past 50 years in men and women in the United States. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. Smoking is estimated to increase the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, of men developing lung cancer by 25 times, of women developing lung cancer by 25.7 times. Smoking causes diminished overall health such as self-reported poor health, increased absentees from work, and increased healthcare utilization and costs. Smoking and cardiovascular disease. Smoking are greater risk for diseases that affect the heart and the blood vessels. Smoking causes stroke and coronary heart disease, the leading cause of death in the United States. Even people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular disease. Smoking damages blood vessels and can make them thicken and grow narrower. This makes your heart beat faster and your blood pressure go up. Clots can also form. A heart attack occurs when a clot blocks the blood flow to your heart. When this happens, your heart cannot get enough oxygen. This damages the heart muscle and the part of the heart muscles can die. A stroke occurs when a clot blocks in the blood flow to the part of your brain and when a blood vessel in or around bursts. Blockages caused by smoking can also reduce blood flow to your legs and skin. Smoking can cause lung disease by damaging your airways and the small air sacs found in your lungs. Lung disease caused by smoking includes COPD, which includes emphysema and chronic bronchitis. Cigarette smoking causes more cases of lung cancer. If you have asthma, tobacco smoking can trigger an attack or make an attack worse. Smokers are 12 to 13 times more likely to die than non-smokers. Smoking can cause cancer almost anywhere in your body. Bladder, blood, cervix, colon and rectum, esophagus, kidney and uterine, larynx, liver, orifices, pancreas, stomach, trachea, bronchus, and lung. If nobody smoked, one of every 3 cancer deaths in the United States would not happen. Smoking increases the risk of dying from cancer and other diseases in cancer patients and survivors. Smoking harms nearly every organ in the body and affects person's overall health. Smoking can make it harder for a woman to become pregnant, and it can affect her baby's health before and after birth. Smoking increases risk for preterm early delivery, stillbirth, low birth rate, sudden infant death syndrome, ectopic pregnancy, orofacial elephantiasis in infants. Smoking can also affect men's sperm, which can reduce fertility and also increase risk for birth defects and miscarriages. Smoking can affect bone health. Women past childbearing years who smoke have lower bone density than women who never smoke or are at greater risk for broken bones. Smoking affects the health of your teeth and gums and can cause tooth loss. Smoking can increase your risk for cataracts and age-related macular degeneration, damage to a small part near the center of the retina, the part of the eye needed for central vision. Smoking is a cause of type 2 diabetes mellitus and can make it harder to control. The risk of developing diabetes is 30 to 40% higher for active smokers than non-smokers. Smoking causes general adverse effects on the body. It causes inflammation and adverse effects on immune function. Smoking is a cause of rheumatoid arthritis. Quitting smoking cuts cardiovascular risk just 1 year after quitting smoking. Your risk for heart attack drops sharply. With 2 to 5 years after quitting smoking, your risk for stroke could fall to about the same as non-smokers. If you quit smoking, your risk for cancers of the mouth, throat, esophagus, and bladder drop by half in 5 years. 10 years after you quit smoking, your risk for lung cancer drops by half. So with that being said, I don't feel that with all of these facts that I have here, that cigarettes should be on the shelf. So that is my persuasive speech, and I hope you all enjoyed it, and thank you for your time.